Okay, now in our final and section of the topic hearing loss, we will talk about non-organic hearing loss. And in this non-organic hearing loss, we will talk about what's the degree of hearing loss and degree of handicap, what is non-organic hearing loss, and also we will talk about what's unilateral hearing loss. So non-organic hearing loss is hearing loss when there is no organic lesion is present. So no lesion is present. So usually it is, chances are the patient might be a malingerer or there is a psychogenic problem in non-organic hearing loss. Clinical symptoms are total hearing loss in both ears, total loss in only one ear, or exaggerated loss in one or both ears. Diagnosis is done by high index of suspicion. Usually the physician or person testing hearing, they have in mind that the patient might be a malingerer because there is no organic lesion or no pathology found. So that suspicion is always in the mind. So that's high index of suspicion. And inconsistent results on repeat, pure tone and speech audiometry tests. That's also the case for patients who are malingerers or for psychogenic, because there is not a consistency in the pure tone and speech audiometry tests. There is also inconsistency in pure tone audiometry and speech recognition also. There is a Stenger test, acoustic reflex threshold, and electric response audiometry. So diagnosis can be done on the basis of all these different tests. Then social and legal aspects of hearing loss. Hearing loss and deafness. What's hearing loss and what's deafness? Hearing loss is impairment of hearing, and its severity may vary from mild to severe. But deafness is complete loss or there is no hearing at all. So that's the difference between hearing loss and deafness. In hearing loss, there is impairment of hearing, and there might be mild that does not affect the normal life pattern or normal skill or normal work activity of the person, but it might be severe that cause the impairment. And then total deafness or deafness is no hearing at all. So these are the differences between hearing loss and deafness. Then hearing loss is further categorized according to mild, serious or severe impairment. So mild impairment is more than 30 but not more than 45 decibel in better ear. So more than 30 but not more than 45. Serious is more than 45 but not more than 60 in better ear. Severe impairment more than 60 but not more than 90 decibel in better ear. So all these are the from mild, serious and severe depending on how bad is the impairment. Then according to WHO, which is World Health Organization, degree of hearing loss, here we have frequency in hertz and then hearing level in decibel. These are classified according to these color. This light greenish is minimal loss, which is about, if you see on the chart, from 15 to 25 decibel. Then mild is dark green, 26 to 40. Then we have moderate, 41 to 55, moderately severe, severe and profound loss. These are the categories according to WHO of the hearing impairment. Then what's impairment, disability, and handicap? Disability is when impairment affects the ability to perform certain functions in the range considered normal for that individual. So disability, when the hearing impairment is such that it can affect the certain functions, is disability. And the disability further restricts the duties and roles expected from an individual by society is called a handicap. So person who cannot, if the disability is such that it is affecting the duties and roles, it's affecting the work at the job or work at the occupation, all these are now the disability is leading to handicap. Hearing loss and difficulty in hearing speech. We have hearing threshold in better ear. This is the level decibel. 0 to 25, it's not significant, no significant difficulty. With faint speech, from 26 to 40, it's mild. From 41 to 55, it's moderate, and after that, now it's moderately severe and severe. And as it goes more and more, it's from disability, the person become handicapped because it's affecting the normal routine or role of the individual. Now, degree of handicap, it's calculated total percentage handicap of an individual. This is the formula by which it's calculated. Better ear person times 5 plus worse ear person divided by 6. So in category 1, mild hearing impairment, decibel level 26 to 40 in better ear. Speech discrimination is 80 to 100 in better ear, and percentage of impairment is less than 40. So if we do by this, better ear percent age is 26 to 40 times 5 plus worse ear times by 6. That's how we can calculate the degree of handicap. Then unilateral hearing loss. Unilateral hearing loss is impaired localization of the sound source, difficulty in discrimination of speech in the presence of background noise. If there is hearing loss only on one side, this mainly affects the localization from where the sound is coming, and it also affects the discrimination of speech, especially if there is background noise present. So that's the unilateral hearing loss, when the one ear is hearing okay, normal, and there is loss in the other ear. So that was all about the hearing loss, and in this lecture we talked in detail about different types of hearing loss, different drugs and chemicals that can cause ototoxicity, what are the non-auditory effects of noise, what are the auditory effects of noise, and we also talked about their management and how they are diagnosed. So hopefully you learned a lot about the hearing loss after this lecture. So thank you for watching sqadia.com.